This morning on BRN, atrial fibrillation is on the rise. Are primary care physicians ready? And joining me now is Dr. Jose Joglar at the UT Southwestern Medical Center. Dr. Joglar, great to see you. Thanks for joining us on the program this morning.
My pleasure, happy to be here.
And we're talking about some research around atrial fibrillation. I can't talk this morning. Let's start with basics here. What is atrial fibrillation?
Yeah, atrial fibrillation is the most common cardiac arrhythmia requiring hospital admission, requiring care. And it is a disorder where the upper chambers are engulfed in an electrical storm, as opposed to the normal heartbeat. We're born with a biological clock in the upper chambers called the atria that makes our heart beat one beat at a time every second of our life. Atrial fibrillation is a rhythm disorder that leads to an electrical storm, multiple little wavelets of electrical activity are propagated in a chaotic way over the upper chambers. So the chambers are quivering instead of beating, leading to a lot of potential negative consequences, including the potential for stroke, the heart weakening. The patients generally don't feel well with it, and other things.
And is this common, doctor?
It is very common, yes.
It is common. And how would I know if I had, would I feel differently? Would I have how would I know I have this?
It is very common. Over the age of 70, we're talking about 4 or 5% of the population.
Mm-hmm.
And those over the age of 80, we're talking about 10% of the population. So atrial fibrillation is becoming increasingly more common as the population ages, but we also, risk factors are becoming more entrenched in our culture and our society. How do you know you have it? Sometimes you feel your heart racing. Sometimes you feel fatigue, tiredness. Sometimes you feel the heart beating in an irregular way. Also, many patients have access to cardiac monitors like the Apple Watch, for example, that are available at the consumer level. And often these consumer-based monitors alert the patient that they have an irregular heartbeat. So there are some patients that don't feel it at all. And in those patients, it's an incidental finding. Sadly, there is a portion of patients whose first presentation is a stroke, and that's what we like to prevent. We like to stay ahead of this problem, as opposed to coming from behind or waiting until a catastrophic consequence takes place.
And, assuming I detect it, whether through my Apple Watch or some other device, or I actually feel the symptoms, what's my first step? Do I go to my primary care physician in order to try to treat or resolve the issue?
Well, depending on the patient, right? There are some patients who have already established relationship with cardiologists, for example. Then you can talk to your cardiologist. Having said that, yes, this is the first time the patient can go to the primary care physician. The first step is to confirm the diagnosis, by the way. That's the first step.
Mm-hmm.
To confirm that these irregular heartbeats you're feeling or what the Apple Watch is reading is actually accurate. And then the primary care physician should be able to refer you for further care.
And is the primary care, in general, I'm speaking in generalities here, I understand that, but are primary care physicians in a position, are they knowledgeable? They're responsible for so many things, doctor. Are they ready to treat this malady and direct somebody where they need to go in terms of the cardiologist?
They are ready to direct somebody where they need to go. The primary care physicians can for sure are totally capable to confirm a diagnosis, make a diagnosis, initiate treatment, for example, blood thinners to prevent stroke, and then refer the patient to somebody like me, an electrophysiologist, who is an expert on cardiac arrhythmias for further management? So the answer is yes. The primary care physician should be perfectly capable of, if nothing else, referring to the right person.
And in terms of treatment, so once they get to you, doctor, or someone who's a cardiologist or an expert, what types of treatment can someone expect? You mentioned, I think, blood thinners, if I'm not mistaken.
Yeah.
But what? Go ahead. I'm sorry, sir.
No, go ahead. I interrupted you.
No, no. I think you know where I was going. What medications or what treatment protocols can you put in place to alleviate this?
So we talking about treating atrial fibrillation. I would like to categorize therapies into two buckets. Okay. The first one is this condition is very well known for causing strokes because the upper chambers are quivering. They're not pumping. They're not squeezing the blood out of the chamber. It's like a bag of worms. And depending on the patient individual risk factors, there could be a greater or lesser risk of stroke. And in that setting, those patients who meet high risk criteria, then they're treated generally with blood thinners unless they have contraindications. But that is the general first step. I told you we're going to do two buckets. The second bucket is to alleviate the arrhythmia for two reasons. Number one, in most instances, the patients don't feel well, and our job as healers is to make the patient feel better. So restoring the normal rhythm of the heart tends to be a better option. And the second reason to restore the normal rhythm is to make the patient also not only feel better, but also to mitigate the potential downstream consequences of AFib, like heart weakening, heart enlarging, and other things. So the treatment, like I said, is stroke prevention and restoration of the normal rhythm.
Doctor, you talked earlier about being proactive, and I think when it comes to some of these chronic diseases, that has been the goal and is the goal of modern medicine. Are there steps that we can take, whether you're a younger person, 40 years old, 35 years old, or even someone a little bit older, to get ahead of the curve? You know, maybe when you go to your primary care physician, going frequently, doing an EKG, other tests that would put you on your toes as opposed to back on your heels, using a baseball analogy as an example.
Well, when we wrote the 2023 guidelines, that's probably what we're discussing, having this conversation. The guidelines, we put a lot of emphasis in those guidelines on risk factor modification and lifestyle interventions. Okay, the atrial fibrillation is an arrhythmia, but we did not want people to see this problem as an isolated electrical disturbance. It was important for us to send a message out to the community, whether it's the physicians or the patients, that atrial fibrillation is a complex disease that is in great part affected or caused by a lot of lifestyle choices we make or a lot of concomitant risk factors. So EKG when you're 35 or 40 is not going to help you for sure, because EKG only helps to diagnose. But we're talking here prevention. We're talking about exercise training. We're talking about watching your weight. We're talking about going to your doctor. If you're diagnosed with high blood pressure, make sure that you're treated in a way that the blood pressure then is well controlled. In the United States, if you look at the two most common etiologies or factors that lead to atrial fibrillation down the road, is obesity and high blood pressure. Of course, aging is also a risk factor, but we cannot turn the clock back.
Not
I
yet.
cannot, I cannot tell a 80-year-old, you know. And at times it might be too late. So, like you said, the best intervention is prevention.
Yeah.
There's no evidence that, for example, if your blood pressure is poorly controlled for 20, 30 years and you develop AFib, at that point, we need to control the blood pressure to prevent the consequences of AFib, but AFib is already there. Having said that, when you are diagnosed with the high blood pressure, for example, in your early 40s or 50s, if you treat it aggressively, then you're less likely to develop AFib down the road than those patients in whom the blood pressure was never adequately controlled. So we have to understand that it's a little bit like other cardiovascular conditions, as you know, coronary disease. We talk about diet, exercise, managing your cholesterol. So this is analogous to that.
Yeah. Well, look, I mean, if it's on the rise, you need to be aware of it, and you need to be proactive when it comes to your health. That remains clear, whether it's atrial fibrillation or any other disease. Dr. Joglar, we're going to have to leave it there. Thank you so much for joining us, and we look forward to having you back on the program again very soon.
My pleasure. Happy to be here. Thank you so much.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details are at our website. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.